Were you aware that you can no longer contribute into a health savings account once you enroll in any part of Medicare? That's right, it's a no-no with the IRS and could get you a tax penalty if you get caught doing it. Hi, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits. And in this video, I'm going to explain why HSA plans and Medicare do not play well together. Stay tuned to find out how you can get our free HSA and Medicare flow chart that will help you avoid any missteps. Today we have many Medicare beneficiaries who work past age 65 at large companies. Some are enrolled in high-deductible group health insurance plans through their employers. These plans are considered HSA compatible, which means that the insurance gives you the opportunity to open a health savings account, which you can use to save for future medical expenses. As a licensed insurance agent, I'm quite familiar with HSA plans and how they work. In fact, I have one myself and really enjoy the fact that I pay no taxes on the money that I contribute into my account each year. I'm also a huge fan of people using them to save up a nest egg of money for medical expenses in retirement. Here's my reasons why. Once money goes into your HSA account, that money is yours forever. It compounds interest over time, and you can use it later to pay for medical expenses in retirement, including Medicare Part B and D premiums, deductibles, copays, and coinsurance. So your high deductible health plan gives you the opportunity to contribute into an HSA, but here's the catch. You can only contribute or accept employer contributions into your health savings account if you have no other medical insurance. And unfortunately, that includes Medicare, even if you just enroll in Part A. Once you have Medicare, you can no longer contribute into your health savings account. Now, if you've watched our videos on Medicare and employer coverage, you'll know by now that most Medicare beneficiaries who are still working at age 65 do enroll in Medicare Part A. That's because Part A costs nothing for most people and it coordinates with employer coverage, which means it could reduce your hospital spending if you have a hospital stay. But since you are contributing to a health savings account, your situation will be different. You will need to postpone applying for any part of Medicare until you retire so that you don't get in trouble with the IRS for contributing into an HSA after you've enrolled in another form of insurance like Medicare. Fortunately, there is no late enrollment penalty for delaying your enrollment into Medicare Parts A or B as long as you have maintained creditable large employer group health insurance that is primary to your Medicare since you turn 65. Later, when you do decide to retire and you lose that large employer group health coverage, you will have the opportunity to enroll in Medicare Parts A and B with no penalty. Here's something else. Be aware that if you enroll in Social Security income benefits, you will trigger Part A automatically. You cannot collect Social Security income benefits without having Part A, so it's important that you don't enroll in Medicare or Social Security income benefits until you are ready to stop contributing into your HSA, which for most people is shortly before they retire. What if you didn't realize this and you have already signed up for Part A and/or you are already taking Social Security income benefits before you retire? If that's the case, you will just need to stop contributing to the health savings account. You can't cancel Part A after beginning your Social Security benefits. If you do, you'll have to pay back the money you have already received from Social Security. Instead, your best option at this point is to just stop contributing, but you can still use the funds that you've already accumulated in the health savings account and spend them on your Medicare Part B and D premiums. Funds can also be used for ordinary approved medical expenses such as doctor visits, lab work, dental and vision costs, and prescription copays. For more rules about HSA contributions, speak with your tax advisor or visit the IRS website. Now, at some point, most of you will set a retirement date and you will need to enroll in Social Security retirement benefits and Medicare Parts A and B to now be your primary coverage. When you do that, Social Security will set your Part A effective date to be retroactive by 6 months. So that means you need to stop contributing into your HSA 6 months before you apply for Social Security benefits so that the IRS won't penalize you for those 6 months of contributions. This means that you need to have already stopped those contributions during those months. Now let's talk about the Part D benefits that you'll need after you retire. Some high deductible health plans do not have drug coverage that is considered creditable for Medicare Part D. In other words, the high deductible health insurance plan from your employer may not pay as much as the standard Part D plan would. If that is the case, your employer is responsible to send you an annual notice telling you that Part D is not creditable, and they send you this by October 15th. They must advise you that your drug coverage is not creditable for Part D. If you receive a notice like this, it means that later when you enroll in Part D, you will likely owe a late penalty. Part D penalties are assessed at 1% of the national average Part D premium per month for every month that you could have been enrolled but were not. At just 1%, it is a small penalty, but it is cumulative. If you postpone Part D for several years, it can add up. You will also pay the penalty for the rest of your life, so it is something that needs to be considered. You should work with a licensed Medicare insurance broker, like those of us here at Boomer Benefits, to help you calculate your potential penalty. Then you can decide whether it is still in your best interest to delay enrollment into Medicare so that you can continue those HSA contributions. We realize that these rules can be confusing and sometimes downright mind-boggling. That's why our team of Medicare insurance experts at Boomer Benefits are here to guide you through this entire process. Be sure to grab our HSA and Medicare flow chart in the notes below this video and give us a call so that we can help you consider all the moving parts. You should also consult your tax professional about your HSA contributions to receive guidance on the financial end of things. Thanks for watching, and we'll see you in the next video.